Ever had that weird feeling where your hands feel like they're asleep, but they're not? That's numbness. It can feel like tingling pins and needles, or even a total lack of feeling. There are a bunch of reasons why your hands might be numb. Sometimes it's no big deal, like you've been leaning on them funny. But sometimes it can be a sign of something more serious. In this article, we'll break down some of the most common causes of hand numbness so you can get a better idea of what might be going on. Let's get started. One of the most common culprits behind numb hands is something called carpal tunnel syndrome. You've probably heard of it, especially if you spend a lot of time typing on a keyboard. Basically, there's a nerve in your wrist called the median nerve. When it gets squeezed or compressed, it can cause numbness, tingling, and pain in your hand, especially your thumb, index, and middle fingers. Carpal tunnel is often caused by repetitive motions, like typing or using a mouse all day. It can also be caused by things like arthritis, pregnancy, and even obesity. Another common reason for numb hands is poor circulation. Think of your blood vessels like a highway system for your body. They carry oxygen-rich blood to your tissues and organs. When your circulation is bad, it means that blood flow is restricted. This can happen for a number of reasons, like if you're sitting or standing in the same position for too long, if you smoke, or if you have certain medical conditions like diabetes or peripheral artery disease. When your hands don't get enough blood flow, they can start to feel numb, tingly, and cold. You might also notice that your hands are paler than usual. Believe it or not, even something as small as a vitamin deficiency can cause numb hands. It's surprising how such a tiny aspect of our diet can have such a significant impact on our health. When we think about numbness, we often imagine more serious conditions, but sometimes the solution is as simple as adjusting our nutrient intake. Vitamins are essential nutrients that our bodies need to function properly, and when we don't get enough of them, it can lead to all sorts of problems. These problems can range from minor inconveniences to more serious health issues. For instance, a lack of certain vitamins can affect our energy levels, immune system, and even our mental health. In the case of hand numbness, the most common culprits are deficiencies in vitamin B12 and vitamin B6. These vitamins play crucial roles in maintaining the health of our nervous system. Without adequate levels of B12 and B6, our nerves can become damaged, leading to that uncomfortable tingling or numb sensation in our hands. These vitamins are important for nerve health, so if you're not getting enough, it can lead to nerve damage and numbness. Nerve health is vital for our overall well-being, as our nerves are responsible for transmitting signals throughout our body. When these signals are disrupted, it can result in various symptoms, including numbness. You can get these vitamins from foods like meat, poultry, fish, eggs, dairy products, and leafy green vegetables. Incorporating a variety of these foods into your diet can help ensure you're getting the necessary nutrients. For example, a balanced meal with a mix of protein, vegetables, and dairy can provide a good source of vitamins B12 and B6. If you're not sure if you're getting enough vitamins in your diet, talk to your doctor about taking a supplement. Supplements can be a convenient way to fill any nutritional gaps, especially if you have dietary restrictions or preferences that make it challenging to get all the vitamins you need from food alone. Your doctor can help you determine the right dosage and type of supplement for your specific needs. Section 5. Other culprits, a quick look. While carpal tunnel syndrome, poor circulation, and vitamin deficiencies are some of the most common causes of hand numbness, they're certainly not the only ones. These conditions can often be identified through a series of tests and examinations, but there are other, less obvious culprits that can also lead to this uncomfortable sensation. Here are a few other possibilities that you might not have considered. Nerve damage. Conditions like diabetes can damage the nerves in your hands and feet, leading to numbness. This is known as diabetic neuropathy, and it can be a serious complication if not managed properly. Regular monitoring and control of blood sugar levels are crucial in preventing further nerve damage. Pinched nerve. A pinched nerve in your neck or shoulder can also cause numbness that radiates down your arm and into your hand. This can be due to various reasons such as herniated discs, bone spurs, or even poor posture. Physical therapy and sometimes surgical interventions are required to alleviate the pressure on the nerve. Medications. Certain medications, such as chemotherapy drugs, can also cause hand numbness as a side effect. This is often referred to as chemotherapy-induced peripheral neuropathy. It's important to discuss any side effects with your healthcare provider, as they may be able to adjust your treatment plan to minimize discomfort. If you're experiencing hand numbness, it's important to talk to your doctor to rule out any serious underlying conditions. Early diagnosis and treatment can prevent complications and improve your quality of life. Your doctor may recommend a variety of tests, including blood tests, nerve conduction studies, or imaging tests like MRI or CT scans, to determine the exact cause of your symptoms. Don't ignore persistent numbness. It could be a sign of a more serious issue that needs medical attention. Section 6. Prevention. Give your hands some love. Now that you know some of the common causes of hand numbness, let's talk about what you can do to prevent it from happening in the first place. Hand numbness can be a frustrating and sometimes painful experience, but with a few simple steps, you can keep your hands healthy and functional. Here are a few tips. Take breaks. If you work at a computer all day, make sure to take frequent breaks to stretch your wrists and hands. This can help to relieve tension and improve blood flow. Try setting a timer to remind yourself to take a break every hour. During these breaks, you can do simple stretches like flexing and extending your fingers, rotating your wrists, and shaking out your hands. Ergonomics. Make sure your workspace is set up ergonomically to minimize strain on your wrists and hands. This includes having your keyboard and mouse at the correct height, using a chair that supports good posture, and keeping your monitor at eye level. An ergonomic setup can make a big difference in preventing hand numbness and other repetitive strain injuries. Stay active. Regular exercise can improve circulation and help prevent hand numbness. Activities like jogging, yoga, and swimming are great for overall health and can specifically benefit your hands by keeping the blood flowing and muscles strong. Incorporating hand-specific exercises, such as squeezing a stress ball or using hand grippers, can also be beneficial. By taking care of your overall health and well-being, you can reduce your risk of developing hand numbness. This includes maintaining a balanced diet, staying hydrated, and getting enough sleep. Remember, your hands are essential tools that you use every day, so it's important to give them the care and attention they deserve. If you experience persistent hand numbness, it's always a good idea to consult with a healthcare professional to rule out any underlying conditions. Section 7. When to worry, don't ignore the signs. While occasional hand numbness is usually nothing to worry about, there are times when it's important to seek medical attention. See your doctor if numbness is severe or persistent. If it doesn't go away after a few minutes or keeps coming back, it's time to get it checked out. Numbness is accompanied by other symptoms. This could include pain, weakness, tingling, or swelling. You have diabetes or other medical conditions. Numbness can be a sign of complications. Remember, it's always better to be safe than sorry. Section 8. Seeking help, your doctor's your partner. If you're concerned about hand numbness, the first step is to talk to your doctor. They'll ask you about your symptoms, medical history, and any medications you're taking. Your doctor may also want to do a physical exam and order some tests, such as a nerve conduction study or an electromyography, to help pinpoint the cause of your numbness. Don't be afraid to ask your doctor any questions you have. The more you understand about what's going on, the better equipped you'll be to manage your condition. Section 9. Taking charge. Be proactive. Once your doctor has diagnosed the cause of your hand numbness, they'll work with you to develop a treatment plan. This may involve lifestyle modifications, like making changes to your work habits, posture, or diet. Medications. Taking over-the-counter pain relievers or prescription medications to relieve pain and inflammation. Physical therapy. Doing exercises to strengthen your wrists and hands and improve flexibility. By working closely with your healthcare provider and taking an active role in your treatment, you can find relief from hand numbness and prevent it from affecting your quality of life. Section 10. Conclusion: healthy hands, happy you. Hand numbness can be annoying and even debilitating, but it's often treatable. By understanding the common causes, prevention tips, and when to seek medical attention, you can take control of your hand health. Remember, you don't have to live with numb hands. Talking to your doctor is the first step toward finding relief and getting back to doing the things you love. Take care of your hands, they do so much for you.